Good morning and welcome everybody to a presentation that we will be doing today for the GWEP. This one is geared towards our professionals, which includes everyone here in NCCOA, so thank you all for joining me. Today we'll be talking about challenges for LGBTQ seniors. This presentation is supported by grant funding from the HRSA, grant number attached. So thank you for their continued support. I have no relevant financial or non-financial relationships to disclose. Over the course of today's presentation, we'll be talking about how to recognize relevant population trends within the LGBTQ older adult population, articulate unique challenges faced by this group, and then mobilize you guys to take action to improve the delivery of care and research for LGBTQ older adults. And before I get started, I just want to check in and see if there's any questions or concerns. Okay, lovely. So in talking about an overview, first we'll be talking about population trends, who are LGBTQ older adults, why we should focus on them, and then unique challenges with regards to three specific main groups: economic insecurities, social disparities, health disparities. And after acknowledgement of this information, we'll be able to move forward into what future practice, research, and policy needs are necessary. So who are LGBT or LGBTQ elders? Well, first of all, I'd like to share some key terms with you. The first one is when I say LGBT or LGBTQ, who am I talking about? I'm talking about individuals whose sexual orientation includes men or women or people who are not defining as either, that predominantly or sometimes are attracted to individuals of the same sex. And this includes the T, which is transgendered individuals, which is actually independent of sexual orientation, and includes a gender identity, which is your internal sense of gender, and or a gender expression, which are things that we would be able to see, like our behavior, our clothing, our body characteristics, that don't necessarily match the stereotypes associated with the gender that was assigned to the individual at birth, or the sex that was assigned to them at birth. The second term that I think is really important for us to all be on the same page about is elders or older adults. And this includes, for the purpose of this presentation, Americans age 65 or older. A few other things that I'll be saying during the course of the presentation that it might be helpful for you to have kind of awareness of is families of choice. Families of choice are the fact that many LGBT elders rely on life partners, close friends, and other loved ones who are not necessarily related by blood for social or caregiving support, which can run into a number of unique challenges as they age. And the second, or the last one, second on this page, last for the purpose of the presentation, is in the closet, which refers to the fact that in order to avoid hostility and stigma, many LGBT elders hide or fail to disclose their sexual orientation during medical procedures, meetings with professionals, etc. And this is considered being in the closet as opposed to being out or living openly. If you have additional questions about any terms that I'm using in the presentation, I've included a link to agingpride.org, which has a lot of wonderful resources for LGBTQ aging and allows you to kind of unpack a lot of these terms if there's anything that I'm saying that is that's new for you. So in talking about LGBTQ elders, we know that roughly 2.7 million LGBT adults are age 50 and older, and about 1.1 million are 65 and older, and approximately 1 in 5 of these are individuals of color. Now, as baby boomers continue to, and more people underneath the LGBT umbrella, we expect these estimates to increase. We also estimate that 1 million more older Americans experience same-sex attractions and behaviors, but don't necessarily identify as lesbian, gay, or bisexual due either to societal stigma or fear of experiencing discrimination. And so if we're looking at LGBT elders by generation. So if we're focusing on older adults, this is going to include a number of waves of LGBT adults or older adults that have experienced a lot of unique changes over the course of their lifetime. And I'd like to start with the oldest generation that you may experience, and this is considered the invisible generation. These are older adults who were born somewhere between the 1910s, the 19-teens, and the 1920s. Older adults, as you can kind of see from my bar graph here, lived through Depression and World War II when being considered LGBT was completely absent from the public discourse, thus the term invisible generation. The following generation, these are individuals born in the 30s or the 40s, so they'd roughly be about 70 or 80 today, is called the silence generation. And this is because they came of age when there was a big public outcry during being LGBT, and they were pathologized by the Diagnostic and Statistical Manual of Mental Disorders, which you can kind of see didn't end until 1973. The last generation that is considered an LGBT older adult or an LGBT elder, individuals currently in their 50s or their 60s, is the Pride generation. And these individuals were born in the 1950s and the 1960s, and they are the generation that birthed what's considered the Stonewall Revolution, which, as you can kind of see from my chart, was when a bunch of riots occurred in New York City that unofficially marked the beginning of the liberal, the LGBTQ civil rights movement. And they also lived through, as you can see, from 70, 79, 96, etc., really decriminalizing of kind of LGBTQ as a pathology, of sodomy. They did a lot of protesting. They have been around for DOMA, Don't Ask, Pro Tell repealed. So all three of these generations that I discussed not only lived through the AIDS crisis of the 1980s, but also legal and cultural shifts around marriage equality. So they've really experienced quite a large amount of revolution over the course of their life. And if we're looking at them as a whole, we see that for the most part, LGBT elders are resilient. They've experienced marginalization, criminalization, which has led to a lot of ill effects, including family rejection, discrimination, and violence. Yet, if we're comparing them to younger generations, kind of 44 years and younger according to this graph, we can see that for the most part, they talk about there being higher levels of social acceptance and more change, and they also report more happiness than their counterparts who are younger. And this is probably due to a number of effects I'm happy to answer questions on after the presentation. So if LGBTQ elders are incredibly resilient, do we need an additional focus? Do we need to focus on challenges? And the answer is yes. There are a number of barriers to successful aging in this population that exist. And so we know the cornerstones of successful aging are economic security, social connectedness, and health and well-being. And we know that LGBT older adults or elders face a lifetime of discrimination and a lack of legal and social recognition, in addition to a reliance on that chosen family rather than biological family, and a lack of culturally inclusive healthcare, all of which result in a number of ill effects. So I'd like to start talking about economic insecurity. So due to a lifetime of discrimination and a long-term lack of legal and social recognition, LGBT elders face deep economic insecurity. 51%, so roughly half, are concerned about having enough money to live on as they age, and about 1/3 live below 200% of the federal poverty line. And as you can see, this includes the oldest olds, those 80 and older, and LGBTQ older adults of color, including African Americans, Hispanic, those who are bisexual and transsexual. And so how does this break down? We'll start by breaking down into housing. There's a lack of affordable house for elders overall. And the protections that discriminate in federally funded and insured housing do not necessarily apply to LGBT population. And so this leads to 1 in 4, about 25% transgendered older adults reporting housing discrimination. And if we look at the states, kind of including Florida below, we see about 44% live in states without any housing discrimination protection due to LGBTQ status. And 48%, roughly half of LGBTQ older adults surveyed, report overt discrimination when they called to seek housing. And this includes, being provided different pricing information over the phone or being told housing wasn't available. Housing discrimination is not occurring now. So we're taking that 60 to 50% of older adults who are not facing housing discrimination now. We know that housing discrimination occurred earlier in life, can lead to longer, more costly search for houses. So older adults who have faced discrimination in the past might be a little bit more reticent to move. They also spend more time in emergency shelters and experience something called unstable housing, which refers to an individual lacking the resources or supports needed to obtain permanent housing. So this may mean moving forward into homelessness, lacking a residence, being evicted or in the process of being evicted, or having to stay with friends, or moving into your car because you lack references or you lack resources needed for appropriate housing. But it's not just housing. Over half of LGBT people in the United States lack protection from other areas as well, including education, jobs, or just kind of financial resources overall. So moving on to unemployment, currently there are no federal laws explicitly prohibiting employment discrimination based on sexual orientation or gender identity. And if we're looking state by state, we notice that there are only 21 states that prohibit this discrimination. And you can see Florida, it has kind of a federal circuit ruling that is sometimes but inconsistently applied to this group. And as a result, LGBT elders who faced a lifetime of employment discrimination and housing discrimination with inadequate legal protections have concerns about their savings and having to work past retirement age. They have lower overall earning potential, and because of this lifelong discrimination and lifelong working discrimination and lower earning potential, when they do retire, their Social Security payments are far, far less. And this lifelong discrimination is also paired with overall marriage inequality. So lower Social Security payments are a problem because 83% of LGBTQ individuals rely on Social Security to fund their retirement. And married couples, especially because DOMA O was only repealed in the recent past, are unable to rely on their partner's long-term savings in order to help them as they age. And so if we look at partnered versus single LGBTQ older adults, we see that those who are partner have a little bit of a buffer, but not as much as their married component. And so when we compound employment discrimination and marriage only recently being available to same-sex couples, what we find is that these compounding areas of social and economic insecurity lead to falling below the poverty line. And so here we have two couples. We have George and Marie. And so you can see we are starting at their monthly individual Social Security benefit. And then their Social Security benefit due to a spouse. And then we're combining their 15 years. But then when we do have one spouse who dies, we see that there's sporadic work history for one individual in the same-sex couple. They're not eligible for spousing benefits. And then when one survivor dies, they lack the survivor benefitship. And so within 2 years, the member of the same-sex couple, June, no longer has any savings, cannot afford groceries, cannot afford property tax, is forced to home. And once home equity is depleted, she has to apply for food stamps, putting her income at 29% of the poverty line, whereas Marie, who is in the same-sex couple, does not face the same issues. And so, as I mentioned before, we have economic securities, but these are also paired with social disparities. So LGBT elders grew up in times when being LGBT and having a partner of the same sex were illegal, compounded with family rejection and marriage not being an option. And so I have an example here from SAGE, which is another wonderful resource to watch out, where we have an older African-American man telling us LGBT elders sharing their stories in their own home. One of the quotes that he said is, "I knew if I stayed in the South, I would be indebted or in jail." And so as a result of these disparities, many LGBT elders build strong networks of friends and chosen family. Unfortunately, these strong networks may be aging simultaneously, so they may not be able to provide care for each other. Also, due to the lack of legal recognition, even though they are there to provide support, since they are not biological family, they may not be able to apply for FMLA in the same way. So they may not be able to take time off for work, they may not be able to share their health term plans, and they may not have the legal recognition to make medical decisions. And so you see, they are finding themselves as mentors, and they do have social support networks, but these social support networks are shrinking due to this simultaneous aging. Relationship recognition is still an issue for LGBT seniors. So even after the freedom to marry became available 5 years ago in 2015, we see that actual marriages are still lagging behind. And so 1 in 3 LGBT older adults lives alone, compared to 21% of non-LGBT individuals. And 1 in 3 are also concerned about being lonely as they grow old, compared to 19% of LGBT people. And so part of this is due to those who are choosing to marry. And so this is a problem because marriage and partnership is one of those factors that we know through research provides resilience and provides protective factors, not only including the economic resources that we talked about below, but social support. And amongst married LGBT older women, the idea identified of children. And this relates to changes in quality of life and protections in health. And so here we see kind of someone who is older and resilient as an LGBT elder who's saying, at the age of 45, I fell in love with my care partner and I knew I was home and I've never looked back. So what she's talking about is that social support and that emotional support and that resilience that comes with being partnered and maybe having those legal protections in place. So I mentioned that 1 in 3 old LGBT elders before lives alone and is concerned about being lonely. So part of this is due to a lack of legal partnership recognition, reliance on chosen family, and lack of funds for LGBT specific aging resources. So it provides them with less outreach, with less resilience, which leads to higher susceptibilities of isolation and loneliness. And we do know that LGBT elders who do live alone, who are experiencing loneliness, have more concerns about their mortality, about dying alone, and in living in pain. And we also know that counterintuitively, these feelings of pain, these feelings of social isolation, increase the chances that they are less likely to access aging services. So they're less likely to visit nurses, they're less likely to engage in meal programs. And so higher isolation also increase the risk for elder abuse, including financial abuse that may occur. So we've covered economic disparities and we've covered social disparities, but compounding this, and probably more relevant to us as healthcare providers or mental health care providers, are health disparities. We know LGBT elders have lived through a lifetime of both systemic and one-on-one sexual orientation and gender discrimination. And this is compounded with social stigma and family rejections and the simultaneous aging and death of their social support networks. All of this compounding together results in something known as minority stress. Minority stress can be defined as the impact of exposure, both interpersonal and structural discrimination. And so you can kind of see on my graph to the right, the number of percentage of older adults who report discrimination. And this includes everything from not necessarily disclosing their identity status to their primary health provider, to feeling that they will be denied medical coverage, which you can see is quite high amongst transgendered older adults. And so these discrimination experiences compound with historic health insurance difficulties. Until 2013, married same-sex couples were not permitted to apply for Medicare as married couples. And until 2014, Medicare excluded medically necessary transition-related care for those who were transgender. And so you can see how this may relate, this lifelong experience with discrimination may relate to LGBT older adults who are not necessarily disclosing their identity statuses. And this also is compounding with difficulties in accessing care, including legal restrictions on visitation, medical decision-making, family leave, or overt discrimination from healthcare providers. So these discrimination experiences compound with long-term care concerns. So it's estimated that 70% of all adults over the age of 65 will need long-term care at some point. However, a majority of LGBT elders don't necessarily want to move into nursing homes due to concerns about isolation and discrimination, as well as abuse or neglect from both staff and residents. And so if you look at one study that looked at experience related to residents' either real or perceived sexual orientation or gender discrimination, you can see there's quite a large percentage of individuals who are talking about verbal or physical harassment, not only from other residents, but also from staff, from partners. And this includes things restriction of visitors to refusal to provide basic services. And as a result, within the community, LGBT elders may delay or not seek out medical care or prescriptions that they need. And this in turn leads to higher psychological distress, including suicidal ideation and alcohol and tobacco use, poor physical health outcomes, including higher rates of cancer, hypertension, diabetes, and physical disability, and decreased specialized healthcare. So elder LGBT individuals are less likely to seek out mammograms or other preventative care. So in summary, there are a number of barriers to successful aging that are occurring within the LGBT community due to historic or current perceptions. And these include reduced financial security, reduced health and healthcare access, and reduced community support. Yet even with these changes, even with this lifelong discrimination, LGBT elders are resilient. They report high levels of health agency and resilience, particularly when we look at things like HIV status, which has been well disseminated and well discussed within the LGBT community. And so here we have an older adult saying, as a Black gay man, I've learned you have to fight the fear of life, the fear of existing in the world. My creative energy and art has made me fearless. And so here we see someone who is not quite 65 and older, but approaching that and telling us he's able to look at his own fear and use it to leverage his own success. And so in moving forward, it's really important that we equip ourselves with accurate information, not only so we can provide accurate information to LGBTQ older adults, but within ourselves and within our communities. And this is in order to help LGBTQ older adults make informed choices about their future. And in order to do this, we should be not only disseminating accurate psychoeducation, but moving forward with future education that focuses on probability-based studies and LGBTQ subgroups so we know which interventions are most effective. And from a policy perspective, we should be pushing that LGBT older adults are recognized by the Older Americans Act as a greatest social need group, which would open important funding avenues to prioritize service and research. And from a service perspective, when we as healthcare providers are providing service, culturally sensitive training for not only ourselves, but other individuals we work with, and healthcare and social service agencies in order to provide support to elders who is critical in alleviating expectations and experiences of discrimination that many LGBTQ older adults fear when they're seeking healthcare experience. So how do we ask? How do we discuss our needs? How do we discuss what is going on with our older adult patients in a way that is culturally sensitive? How do we use the right words? How do we ask about partners? How do we ask about spouses in a way that's gender neutral and allowing our clients to kind of provide our patients to provide us the best information possible? So other things that we can do outside of trainings like these, being aware of your resources. And this includes, as you can see from growth, housing for LGBTQ older adults, including some resources here in Broward. And also being aware of building the foundation for change. not only immediate relief, but how do we create infrastructure and alliances? How do we understand aging issues? So this presentation is a great example of how we can understand LGBT aging issues, but now it's up to move forward. And I have some great news, which is that here in Broward, there are some really wonderful and great resources, including the Noble A. McArthur Senior Day Center, which is located here in Fort Lauderdale and offers varied activity for frail, gay, lesbian, and straight elders in a home-like atmosphere. And this program has been well noted by other programs like SAGE, which serves Broward and the Palm Beach and has a media center to help kind of senior action in gay environments, and a Florida AAA program that has reached out, which includes funding for these communities. If you're interested in more about any of the that I've taught, I do have a reference site, but I want to point you to a number of resources out there, including the Williams Institute LGBT Aging Report, Out and Vigilable by SAGES, and encourage you to visit sage.org, which is a wonderful research for information on aging within the LGBT community. And so in order to kind of make sure that we're meeting our goals, what I've provided here is a link on the web browser. And what I'm going to do is I'm going to leave this up in order for you to take the link to this training and use this as an opportunity to open up for any questions and concerns that might have arisen during our presentation. So if you have any questions or concerns, if you could raise your hand, I can address them one at a time. Yes, Catherine?
Yes, I thank you for this presentation. I kept thinking during the lecture about all of the assisted living facilities that we have here, particularly in South Florida, and what a large wave of older adults will be transitioning to those, and how LGBTQ older adults may be facing discrimination on a larger scale as that transition occurs, when the healthcare workers or facility management is not sensitive to being culturally appropriate and caring. And I had always recognized this more like an inpatient sort of basis, because we saw both in a private children's hospital and then in a government-run inpatient facility that especially transgendered individuals or queer individuals had to be given individual bedrooms because they couldn't be paired with their, biologically determined sex roommates. And what ended up happening is that they would be placed in the hallways, and that is it was terrible. It was absolutely heartbreaking. So we're going to need to disseminate information like this much more regularly as we wait for that big wave, so that practices that people are sort of fumbling around with now can be corrected.
Yeah, you bring forward a great point that I think I forgot to say during my presentation, which is that Broward and South Florida actually has the largest number of LGBTQ seniors in the nation, especially those transitioning to assisted living. And some centers are aware of that, as you saw from the Broward resources, but there's a lot of individuals that are still finding themselves falling between that gap. And the broader the dissemination of our training, the more that we're doing this outreach, the better served those individuals can be. And that way we're not placing people in hallways and creating social isolation or loneliness issues. Great point. Anyone else have any other questions or concerns or comments? Go ahead.
Yes, I recently had a journal club discussion regarding neuropsychological evaluations for transgender individuals in particular. Older adults that were transgenders and had concerns with memory difficulties, so they were seeking neuropsychological evaluations to assess for potential dementia diagnoses or rule out dementia diagnoses. And it was quite interesting how, depending on the type of hormone replacements that they were using and the duration, it had an impact on their cognition, and it was different than, say, what a normally profile that you would see for a person with dementia. So I will pass it along to everyone at a later time, so you can read through these articles. It was quite interesting.
No, thank you for sharing. Yeah, from what we know about minority stress, we do know that kind of if you're in a place where you're very anxious or maybe nervous about disclosing either your gender expression or your sexual orientation status, that might cause a lot of deficits in things like working memory or executive functioning, and being able to kind of communicate clearly with your providers might not be your first option, or you may not be able to do that as coherently. And then we know that you may not be allowed in the room with one of your loved ones, which could create further levels of anxiety. And so moving forward, I think it's up to us to, if you could send that along, that would be wonderful. I'd be happy to put to our NCCOA site. But the more dissemination we have, the more knowledge we have, I think the better we can do. Thank you. Any other comments or concerns before I stop our recording? Well, I want to share my references with you in case anyone is interested in reading more about anything that I've talked about. And if not, thank you all. And I will see you on the other link.